Welcome back to NST Spinal Integration and the Advanced Level DVD presentation. I'm Michael Nixon-Livy, and it's a great pleasure to be back as your tutor throughout this live hands-on presentation. So ultimately our goal for this training is to in fact improve the work that you currently know and then expand upon the system so that it can be utilized for so many other chronic cases. Essentially, we can reduce our two objectives of improving the work you currently know and expanding the system into three simple goals. First goal is refinement, the second is that of adaptation, and the third and the largest is potentization. Let's have a look at them all. Basically, refinement equals accuracy, and if we can make sure that our NST work is accurate, particularly the core, then we have every right to expect that we should get better results instantly. Two very important points to activate correctly. They're the two of the main points of the neck. Very, very important. Point number three, as you'll recall, is more of an insurance policy point. This is to reactivate the insertion of levator scapula now back onto the superior medial angle of the scapula itself. There we go, done. And point number four are the insertions of the upper trapezius right into the base of the cranium. So once again, we've covered this pretty well in our core and categories presentation, but just to remind you, the insertions of the upper trapezius and the point where we need to be is right here. I'm partly on muscle insertion, partly on bone. So just below the inferior nuchal line of the cranium. That's where we are. So we start with two middle fingers together, right at that point. So if I slide up the back of the musculature of the neck and I bump into the cranium effectively, that's where I stop. That's my stop point. So it determines where it needs to be itself. If I gently follow up, there I am, I've hit the cranium. So part of my finger is on the cranium, the pad of my finger is on the insertion of the upper trapezius. Very, very receptor-rich point for the cranium. Really helps to regulate a lot of cranial motility. So I'm sliding up, there I am, make contact. I stretch, first part of my prime move, a very short stretch in this case, not much tissue to stretch. Stretch, contact, and back toward the midline. Stretch, contact, back towards the midline. First 4 points done. Welcome back to our second important goal of the workshop, adaptation. Adaptation basically means adding more flexibility and variety to the work we currently already know, essentially adding new tricks. We'll be looking at ways to enhance and improve Dynamic Body Balance Part 1, Part 2 and Part 3. And on top of that, we'll add some useful work in the sitting position for the thoracic and shoulder areas as well. Firstly, my object is going to be to make a comma toward the outside, as you can see in your diagram. And to do that effectively, I stretch the skin back, as we do with all prime moves, and then I place one finger on top of the other, or a thumb, as it is in your diagram, on top of the other, to exert a little bit extra pressure. And this is really good. This gives me a much better reset of the ligament. So I stretch, big breath in, please carry, and breathe out. And as you breathe out, I make a deep move around the corner. And I come back, I recheck my ligament, and immediately it's softened. It's reduced and gone back into its normal position. So that's a good sign. So this brings us to the conclusion of our second training goal of adaptation. And we've literally covered a lot of new points, mini protocols, individual points, clever strategies that can be blended into our core work, Dynamic Body Balance Parts 1, 2 and 3, or a whole session with other procedures in to build a more powerful and detailed session. Essentially what we've seen here is going to open up and empower your NST work so that you can get quicker results, shorter time frames with much better sustainability. Welcome back to the NST Spinal Integration Advanced Level Training and our final section of potentization. All of the procedures in the potentization section have been chosen because of their suitability and dependability in a variety of different clinical situations. And all will add a dimension of power and release to the work that you currently know. To summarize things, we could put the advanced procedures into three separate categories. Firstly, there is a main eclectic category with 8 individual procedures. Secondly, an occasional category with 3 individual procedures. And finally, a TMJ and cranial category, also with 3 individual procedures. Our next procedure in the advanced level presentation is the hand procedure. Now, the hand procedure is completely different to other procedures in as much as we really need to focus our attention on micro prime moves. These are very, very small prime moves we'll be doing across some of the smaller tendons. But the indications are for any symptom of the hand whatsoever. Pain, stiffness, swelling of the hands or the fingers, even carpal tunnel syndrome will respond well to this. So, point number 1 of the hand procedure is to block the extensor tendons of the thumb, and as we do that, our second point is to locate where they might be. Now, this is an important point because not everybody has their extensor tendons in exactly the same place, so we need to investigate a little bit, palpate. There they are. As I roll across them, they're quite easy to find, in fact. I do so a couple of times until I feel a very subtle give in the surface tension of the skin. We now move to the second procedure in our occasional group, the advanced scoliosis procedure. So just for some clarification, it may be useful to consider scoliosis, which we all know is a lateral deviation of the spine, into 3 simple categories. Firstly, acute scoliosis. Secondly, chronic scoliosis. And thirdly, idiopathic scoliosis. Our next part of the advanced scoliosis procedure is then to open the complete channel from the bottom to the top. We would open as many points as you need to, all the way along the channel until we come to the top. Here we go. There we go, all the way up as far as T1 if you can. Same on the other side, always left side first, then right side. Open, open, so I'm opening a series of points here. All the way up to the top. There we go. And I pause. We've now arrived at our final group of procedures, the temporomandibular joint and cranial group, containing 3 important procedures that I'm sure will become favorites once you familiarize yourself with them. These are the advanced temporomandibular joint balance, the ocular release, and the cranial respiratory impulse technique. In particular, the cranial bones, the teeth, the temporomandibular joints themselves, the nerves, the important nerves that go to make that system very functional, and any of the ligaments and other soft tissues that comprise that system as well. Basically, how it works is that the microsystem, which is in the superstructure of the body, exerts a hierarchical influence over the macrosystem, and therefore really deserves not only our attention, but certainly priority in our session. So the correction, in this case, would be to hold your tongue forward, please, Kerry, and touch your both TMJs. So the client needs to touch her own temporomandibular joints in this case, and the job of the practitioner is to gently bump the mandible directly backwards so that the condylar heads of the mandible are creating an impulse inside the capsules themselves. Then the final thing to do is I release both sternocleidomastoids, as you can see on your diagram, and that completes the advanced vertical atlas balance. So this brings us to the conclusion of our NST advanced level training, and we've now satisfied our 3 training goals of refinement, adaptation, and potentization. Throughout the process, we've covered an enormous amount of territory therapeutically speaking, and we have literally a smorgasbord of work ready for integration into our core and categories work. By employing this new level of advanced work, you're literally going to move mountains, therapeutically speaking, and I wish you every success and enjoyment in the process of applying and adding this new work. So it's been a great pleasure to have you on board. I thank you once again for your attention throughout, and I wish you, your loved ones and your clients every success in attaining optimal health.